They're going to learn 10 times over what they're going to learn in a classroom setting.
How do I communicate with a physician or a nurse practitioner one-on-one?
This is a great, safe space
to bring that further depth to the learning versus what a book can offer you.
My role is the clinical simulation specialist here in Austin, and so my job is setting up the simulations. So this is my first time being a standardized patient.
That was a complex simulation that we used to help students learn concepts of how do we address family members on top of our patient care. We used this as an IPE activity where we had PTs, SLPs, and OTs, and a few nurse practitioners come in and address how students need to learn about the other professionals and what they can bring to the table.
The entire facility is outfitted with audio and video. We also have a ton of medical equipment. All of it is real equipment, although we use it for simulation purposes here.
We saw the university thrive with its technology and ability to bring the students into the new age of healthcare, because it is not just paper and pencil anymore. We have to include the technology into the learning, because that's where we're treating patients, is with that technology as well. So the university really supports faculty and the drive to bring practitioners out that are next level practitioners.